Work with your relative to assess their needs. Before you can provide care for an elderly person, you need to figure out what kind of care would benefit them the most. Depending on their overall health and how well they can manage day-to-day tasks, they may need anything from occasional help to constant support. Talk to them, spend time observing them, and work with their healthcare providers to determine their needs. Keep them involved in their care decisions as much as possible. If your loved one feels that other people are making all their choices for them, they may be more resistant to receiving help. To help them feel more independent and in control of their situation, include them in all conversations and decisions about their care. Communicate openly and honestly with them and ask them for their input and opinions about any options you are considering. Install safety features in the home. Whether your loved one is still living independently, is staying with you, or has live-in support, you can help them by making their home environment safer and more accessible. Get advice from a doctor, an elder care specialist, or a physical or occupational therapist about the kinds of modifications that would benefit your loved one the most. Help your loved one stay active. The CDC recommends that older adults get at least 150 minutes of moderate exercise each week. To help keep your loved one healthy and happy, encourage them to incorporate manageable levels of physical activity into their daily lives. Stay involved in their medical care. Most older adults deal with a variety of age-related illnesses and health conditions. To ensure that your loved one gets the best possible care, talk to them and their healthcare team to familiarize yourself with the specific issues they are dealing with. Keep an eye out for any new or worsening symptoms and make sure they seek medical attention if you notice any changes in their condition. Encourage them to socialize. Older adults who spend time with friends stay physically, emotionally, and mentally healthier than those who don't. Urge your loved one to socialize as much as possible, even if it's just chatting on the phone with a friend. Offer to help with chores and errands. As people age, it can become more difficult for them to manage day-to-day tasks like cooking, cleaning, and grocery shopping. Talk to your loved one about what you can do to help them meet these needs. Talk to them about their finances. There are a lot of expenses and financial difficulties associated with aging, from dealing with medical bills to covering the costs of safety upgrades in the home. If your elderly relative is retired, they may need additional financial support to cover their expenses. Talk to them about what financial resources they have, such as pensions or retirement savings, and develop a plan to help them out if necessary. Ask the hospital staff questions about their care. Having an elderly loved one in the hospital can be scary and overwhelming. You'll feel calmer and be in a better position to help them if you understand their condition and what their treatment options are. Talk to your loved one about their treatment wishes. It's important to keep your elderly loved one involved in any major decisions about their treatment as much as possible. Discuss the possible treatment options with them if their condition allows it. If not, try to follow their wishes to the best of your ability. Advocate for them if their needs aren't being met. Your elderly loved one may have a hard time speaking up for themselves if they're very ill or have communication challenges. If you don't think they're getting the care they need, don't be afraid to speak up for them. Be assertive about asking questions or letting their care team know if they need help. Bring them any supplies they need. To help your loved one stay comfortable while they're in the hospital, pack a bag with anything they might need from home. Visit them frequently. To prevent your loved one from feeling alone and to make sure they're getting the care they need, stop by as often as you can. Try to be around during times when you know they might feel lonely or distressed, such as during mealtimes or when they have to have tests or medical procedures done. Take care of any important paperwork. There's always some red tape involved in a hospital stay. If possible, find out if your loved one has a healthcare directive, such as a living will, healthcare proxy, or power of attorney, and find the relevant documents. You may also need to sign consent forms or other hospital paperwork if your loved one can't do so themselves. Make a hospital discharge plan. Before your loved one leaves the hospital, have a conversation with their care team about what kind of care they will need going forward. Ask their doctor to recommend a home health care provider. If you determine that your loved one needs in-home medical care, their doctor may be able to recommend a reputable provider. They may also be able to prescribe specific in-home services, such as physical therapy or nursing, which can make it easier to get insurance coverage for this type of care. Research nursing homes if home care isn't an option. Sometimes it isn't practical or affordable for an elderly person to live in their own or a relative's home. If you don't think your loved one can live independently and you're unable to provide the home care they need, look into nursing homes or other residential care options in your area. Search for financial assistance programs in your area. If you're having trouble covering the costs of care for your loved one, you may be able to get help. Depending on their needs, you may be able to get funding to cover expenses such as medical bills, housing expenses, utilities, tuition for continuing education, or food costs. Do a search online for benefits available in your area. Look for programs that provide meals and other services to the elderly. In addition to financial help, there are a variety of programs and services that can help meet other needs for seniors. For example, your community may offer resources such as free meals delivered to your loved one's home, assistance with home repairs or home safety renovations, or free or affordable legal assistance for seniors. Find a support group if you need emotional support and advice. Caring for an elderly relative can be challenging. If you need additional support or advice from other people who are in a similar situation, a support group can be very helpful. Do a search for caregiver support groups near you. Hire a geriatric care manager to help you make good decisions. A geriatric care manager is someone who specializes in evaluating the needs of elderly people. If you're not sure what kind of help or resources your loved one might benefit from, a geriatric care manager can help. Check with your local government's agency on aging to find out about geriatric care management services in your area. Be prepared for resistance from your loved one. Many elderly people want to remain independent for as long as possible, and they may resent your efforts to try to care for them or connect them with elder care resources. If this happens, try to be patient and empathetic. Take time to discuss your concerns with your loved one in a respectful and open-minded way, and do your best to take their preferences into account. Ask their doctor for advice if they have communication challenges. Many older people have a difficult time communicating either because of cognitive changes or due to physical health problems, such as hearing impairments. If you have a hard time communicating with your loved one, ask their doctor to recommend resources that can help. Reach out to family and friends for support. Caring for an elderly relative alone can be overwhelming. If you need help, don't hesitate to lean on your support network. Talk to family and friends about how they can help. Practice self-care to prevent caregiver burnout. You won't be able to care for your loved one if you aren't taking proper care of yourself. Make sure you take time to eat good meals, care for your own health, and do things that you enjoy, such as working on hobbies or spending time with friends.